So today's video is a very important one, especially for you females in the group. So it's important that we understand first of all how female health can have an indirect effect and also a direct effect to your nutrition. So first of all, it's important to speak about female health because it 100% could affect your ability to see change. Literature suggests that a cycle length of around 28 days with a period lasting between 3 and 5 days is seen as normal, but it's vital to note that this is highly individual, and as cycle length varies between 21 and 35 days, and it can also vary cycle to cycle too. So a woman's cycle provides a really good snapshot of your overall health. Though you encounter premenstrual symptoms, or PMS as it's commonly known, and these actually start about a week or two prior to menstruation. There's over 150 noted symptoms in literature, including the main ones maybe that you've heard of or experienced would be anxiety, mood swings, crying, ab pain, tenderness, fatigue. Most important to us though is cravings. So monitoring your diet can become really troublesome, especially if cravings are unmanageable. There's an argument there that cravings are psychological outcomes of our social conditioning. But for some reason, this may also be correct for some women who have a real psychological drive to seek out some foods that maybe are quote unquote seen as unhealthy, or some that are higher in calories. So what can we do to ensure that we're in the best position possible to prevent ourselves from subsiding to cravings or having a harder time around menstruation or prior to? So your cycle has been split into phases. You can use the table within the email to help manipulate your intake and also align it with your cycle. But it does mean that you need to understand your symptoms and also track your cycle. Without one or the other, all the nutritional strategies within the table are also kind of null and void because you're playing a guessing game. Again, the more subjective data we can have, the easier it is to make change and strategize around your cycle. So before we finish up, it is important also to note and understand that there are other aspects of female health which I haven't covered. So I've missed them, not purposely, but just because they're all other branches of the nutritional chain, but they all link in certain ways. But it's also still important. These could be something as simple as birth control, pre and postnatal, or polycystic ovary syndrome, or PCOS. It's important that we chat about these, but we'll chat about these on a one-to-one basis should they be required, as opposed to me covering them more specifically, and they're not really related to the broad spectrum of female health. So if you do require some one-to-one about that, you can message and we'll have a chat about it even during your check-ins. For now, quickly read over the information in the table and then some of the studies that I've linked. There's some quite important ones, and I'll see you tomorrow.